Walker, Emergency Preparedness Coordinator for the Hamilton County Health Department, joins me this morning. Good morning.
Good morning, ma'am.
So we've started to see our numbers of positive COVID cases starting to fall. What are we attributing that to? Is it the holidays? Is it a lack of testing, or are we just maybe doing better?
They are starting to fall, and I'll try and share the screen here with you so we can take a look at them. So we can see our numbers dropping off quite quickly after the first of the month for December. There's dropping off. Some of that, we look at the 2 weeks post holiday because we've had empirically we've had spikes after the holidays, and I think that's what attributes to these really high, almost 500 case days here. But we've seen it steadily drop off. So I think we can attribute some of that to people doing the right thing over the holidays and keeping it small and keeping it safe. Then we can come across and look at the tests, and we see right here this big spike in tests. This is really the run up to holiday travel for Thanksgiving, and then it dropped off after the holiday, and then it picked up pretty steadily for those 2 weeks after here. So I think I don't think we attribute the numbers dropping to the lack of testing, because they are still pretty high pre-Thanksgiving holiday here, when we really expanded our capacity for testing. So I think without looking at the hard science of it, we can just make some basic guesses based on what we're looking at. Is that people did the right thing. We made it through Thanksgiving holiday. People did the right thing, and I think we're seeing the results of that. And hopefully we continue to see those results through the Christmas holiday and the New Year holiday as well.
Yeah, let's talk about that, because we saw in the news millions and millions of people traveling over the holiday weekend, many flying. Tips for those folks as they return home.
Biggest thing is try to limit your exposure to folks outside of your social circle. If you start feeling symptoms, no matter how minor, schedule a test. Typically, you'll get a PCR test, and I've heard they're getting down much lower than they were post Thanksgiving, and that they're down even below 3 days most of the time now. I've heard of a few people getting their results back in 12 hours. Now, I don't think that is to be expected every day, but some people are finding out extremely rapidly. The states really got their labs firing on all cylinders, and they're getting those numbers, those turnaround times down too. Additionally, if people do show up with signs and symptoms at the test sites, most of them are offering Binax rapid tests at this point as well.
Let's talk about testing, because we still have the New Year's holiday coming up this week. Any changes in testing locations or hours?
Yep. So the 4 sites that we operate at Hamilton County will be open normal hours. They're normally scheduled hours, and you'll see those hours when you sign up for your testing on the state's website. However, they'll open normal hours New Year's Eve. They will be closed New Year's Day, and then they'll resume normal operations on the 2nd or on the 4th, depending upon what day they normally start back up on.
Let's talk vaccinations. That's the big headline right now. When we start to see that happening beyond just healthcare workers here in Hamilton County?
So what we do know is that the Moderna vaccine was approved last week. We do know that it's already been shipped out to Hamilton County. It's still at the hospital level right now, and it's still geared towards healthcare workers. They've already expanded the phase 1A once, and it sounds like that, twice, because they've added EMS, and now they've started adding people that provide testing and other healthcare workers that may be exposed to COVID that don't necessarily work in a healthcare setting. It's my understanding that CVS and Walgreens are getting ready to start hitting the long-term care facilities this week. So that will help one of our other largely at-risk populations. We're waiting any day. We suspect shortly after the first of the year that we will start looking at the next phase, which will most likely move into responders and then into the 75 and older population, regardless of what facility or home they live in, or if they live at home in their own residence. We'll start expanding into that next at-risk group. and then it'll just keep branching out from there.
But wait, you can't really tell us beyond that who's next in line, correct?
We don't necessarily know here at the local level. We do know that the CDC's advisory committee on immunization protocols has made their recommendations, and in a nutshell, it's first responders, fire, EMS, essential workers, frontline essential workers, which includes grocery retail workers, and those 75 and older. Now that's the recommendation. Then it goes to State Department of Health and their advisory committee. And from there, Dr. Weaver's group and that advisory committee, they make the actual policy on how we vaccinate here within the state of Indiana.
That's obviously not something that Hamilton County Health Department is going to be able to do on its own. So are you going to be looking for volunteers? And if someone's interested in helping out, how can they help out?
We are always looking for volunteers to help out, especially with something that's going to be so long-term and labor-intensive as vaccine is. One thing we would recommend doing is folks going to the state's website, coronavirus.in.gov, and you can click on the professional resources, and right on that front page, it has a link to sign up to volunteer. And it's pretty comprehensive. It asks your availability, your licensing, what areas you're willing to work, and things like that. Then we as vaccine providers can go to the Bowen Center and say, we'd like volunteers. Do you have anybody that matches up with our community? And they send us that list, and then we can work on it from there. So we are working on it. I would encourage anybody that's willing skilled labor, whether you're a licensed medical professional or not, even if you can just help with clerical functions, there's a role for everybody in this. You may not work for us in Hamilton County. You may work for the city of Fishers. You may work for Marion County. Whatever your availability is, there's most likely a spot for you to help out if you're willing to help out. Fantastic.
Anything else you want to add? I didn't ask. Any thoughts as we move into the New Year's holiday?
Well, I think, it's been said before, we're starting to see the light at the end of the tunnel. We just need to hang on, be patient, continue those good practices of social distancing, wearing your mask and hand washing and those types of things. And, we will get through this. We've learned a lot in the last year, and we're starting to approach the end game, which is kind of a good feeling here. Now, I don't want to get anyone's hopes up that it's going to be soon, but, we're hoping that we'll be doing public vaccination by summer.
Fantastic. Chris Walker, Emergency Preparedness Coordinator with the Hamilton County Health Department. Thank you again. We will check in with you next week.
Hey, thank you.